All right, everybody, welcome back to the podcast. On today's episode, we have a very special guest, Elizabeth Morrison. Elizabeth, how are you, ma'am?
I'm great. Thank you very much for having me on today.
Yes, ma'am, absolutely. I am excited for this conversation. For people that don't know anything about you, Elizabeth, can you please tell us a little bit about yourself and what you do, please?
I am a licensed therapist, coach, and consultant in Texas, and I work with neuro-inclusive systems design and apply that throughout my therapeutic and my coaching work, as well as that consultation work. I essentially help people find out why things feel harder than they need to be and help them to design systems that work a little bit better for their fit.
Wow, that's really cool. But what's your demographic? Like adults, you see kids, anything?
I mostly work with neurodivergent adults. We do a lot of autism, ADHD, late identified folks, people who are experiencing burnout, high performance individuals will oftentimes be in that same kind of a burnout state. So anyone who's got a misfit.
Gotcha. Elizabeth, how do you make sure that the clients are a good fit for you and that you are a good fit for them?
That can be a little bit challenging, but I try to present upfront what I do and how I work and really allow them to understand what kind of a style that I do have, which is pretty direct, fairly laid back. It's not totally clinical, it's more of a collaborative. So I'm looking to form kind of some operational definitions, figure out where those mismatches are, and then we would work together to figure out how we need to design a better system.
Oh, that sounds wonderful. And so if a client were to reach out, are they able to do maybe a
Mhm.
consultation call or is there a Zoom How does that work?
Absolutely.
Yeah.
So I've got straight on my website, you can get into that client portal and sign up for a consultation call if you'd prefer, or send me a little note that says you're ready to just sign up to get started with things. And I do have some packages as well as individual services available. So you know what you're getting into in front.
Yeah, that's really cool that you're transparent, keeping everything right there on the forefront. Elizabeth,
Mhm.
if somebody partners with you and they seem to be a good fit for them, you're a good fit for them, they're a good fit for you. What does the first session look like?
It is going to be really getting down to that collaborative approach. So it's going to be mostly about figuring out what has been overloading you, where your capacities are lying, how rest looks for you. Depending on if it's the therapeutic or the coaching, there might be a few different intake questions there. And then we're going to really get into assessing for fit. So I have an assessment tool that I use that is directly looking at fit. It's looking at fit individually within that human system, the household fit, their work environment fit, all the different contexts that might be important to that person's life. And then from that assessment tool, it gives us a nice little treatment plan or a coaching plan to be able to know exactly where we're going. And then we can judge anywhere that we need to.
Oh, that's awesome, Elizabeth. Yeah, it sounds like there's a really good system in place to make sure that the client is a good fit for you and you're a good fit for the client.
Mhm.
That's awesome. There's a
Yeah.
lot of specialties out there, Elizabeth. We have EMDR, CBT, DBT, all the things, right? Wonderful things. Which specialty do you kind of focus on?
So I actually developed a framework that uses a lot of different models. I will pull from whatever works, very gestalt with what's needed in the session. But I do work from what's called the Neurocontextual systems model. And that really is, like I've described, where we look at fit mismatch. And then we also look at the narrative injury that compounds over time when you're living a life that doesn't fit you. You're constantly burned out from that, barely able to recover. We get some internal narratives that can come with that. So NST really addresses both in a dual pathway approach so that we're making sure we're getting the practical solutions and we're also repairing some of the narrative damage done over time.
Yeah, that sounds wonderful, Elizabeth. And a lot of clients will come to the office and I'll be like, how long is this going to take? And it's really hard to give
Mhm.
somebody a timeline. How do you prepare your clients for the inevitability, excuse me, that progress may look like one step forward and a couple steps back sometimes?
Definitely. One of my favorite analogies, I'm a big metaphors person is that of cleaning a house. So I will often explain that therapy or coaching with me is a little bit like cleaning out an older house. There are going to be some parts that are still pretty lived in, and might just need a little bit of sprucing up. But we're probably going to find a room that hasn't been opened in a while as well. And there might be some stuff stuck to the floor, and it might get a little bit gross before it gets clean.
Yeah, that makes a lot of sense. Okay, so a client comes in, they do the consultation call, they seem to be a good fit, first session's done, they're prepared for what's about to happen. What does progress look like when they work with you, Elizabeth?
Which is going to include not just symptomology, whatever they're coming in with as that base problem, but it's going to include making sure that they have a sustainable fit that they can take throughout. So it's not that life's going to look perfect from here on out, but it is going to be a series of finding the right systems internally and externally for you, when then we have to figure out how to make those sustainable long term so that when you do hit a bump in the road, you still have the capacity to deal with that.
Yeah, that makes a lot of sense. And Elizabeth, can you kind of shed some light on what a system
Mm,
looks like in your
mhm.
work?
So, if we were going to take a personal system, an individual, I am a system of biology and narration and neurochemistry, and I've got a lot of processes working. And internally, those systems are going to be my emotional regulation, they're going to be my physical regulation, along with that sensory regulation and that executive functioning. If we think of it a little bit like a system where they all work together, getting capacity in one of those systems allows other systems to be able to overflow into those a little bit. And so when we can get all of those systems really working together, then we have that bounce back, we have that capacity, we have resiliency.
Yeah, and as you were saying that, Elizabeth, me being a gearhead, I like cars.
Mhm.
It just reminded me of like a vehicle. It has like the electrical system, the gas system, right? The hardware, all kinds of little
Yeah,
systems that are interconnected. And if one's kind of misfiring or malfunctioning, then it could really affect all the others. So that really kind of put it into
yes.
perspective for me.
One thing that I
Mhm.
like to do is kind of tinker around. So I've made an interactive tool that is, for instance, a flight simulator is one. You fly your nervous system to get an understanding of your systems, how they work, what does overload them, and how to recover while you're flying through your nervous system.
Wow, is that an app you mentioned?
It is an interactive web page. So
Got
I've got the first part of it already going, and the second part will be loaded this weekend.
Wow, that's really cool. Have you used it with any clients yet, Elizabeth, or are you still in that developing phase?
So I've just gotten to take it out for a few spins. And so far, now I have used it on the clinician's mode, which does give a lot of feedback that I can provide to that client as well. And it really allows us to look at the clinical implications of that together. So at home, I have not had any clients try that out yet, although I do make my partner the guinea pig for a lot of those things. But in the clinical setting, it has been really helpful for the client to be able to process through their decision making and how those impact, because there aren't good or bad decisions. It's about that fit. Is this fitting me here to sustain what
Mhm.
comes later? Is this fitting me here so that I can sustain a lifetime?
Yeah, yeah, and that's really cool, and I think that you going out of your way and going above and beyond to create these products and these resources, really is a testament to the type of clinician that you are. So I just wanted to give you kudos, Elizabeth, because I think that's really awesome.
Thank you.
Elizabeth, I one last question on a client's journey with you, and that is, how do you know if they're ready to graduate or kind of terminate therapy?
Would be when those systems are sustainable. So we've gotten a good fit. We've worked out some of the kinks that might happen along the way, and they have an ability to recover and repair when ruptures or when barriers come up, that they're able to figure out how to manage their own systems in a way that allows them to be resilient and to recover. And once we've reached sustainability with a good recovery rate in there, time to go fly yourself.
Yeah, that's really cool. Elizabeth, yeah, thank you for sharing that. I'm curious about the client who terminates successfully. Are they able to come back if they need more help, or how does that work?
Absolutely. And we discussed that at the termination or even prior to that, what that ongoing model will look like. So for some individuals, it's yearly check-in, just like you do with your doctor. Other folks, it might be bi-yearly, and other folks, it's more of an as needed. If those systems are coming to a place where we're not sustaining as well or recovery becomes a little bit harder to obtain, come on back and we'll make sure that we have the right fit again.
Yeah, so it sounds like they're always welcome to come back if they need additional support. Yeah, that's awesome. Um,
Absolutely.
Elizabeth, if somebody's watching this episode and they're liking your style, they're liking how you present yourself and what you have to say, but they're nervous about reaching out, maybe because they've never actually been to therapy, or it's just something new. What would you want them to hear?
I would want them to have an understanding that it is a collaborative approach and you are allowed to take it slowly. We in therapy, coaching, whatever side of this business you are on, we're service providers and we are providing a service to you as that client. And that therapeutic rapport, coaching rapport is so important. And if it's not feeling like a good fit, we can figure that out and make sure that we have you at a good fit, but really it is just about reaching out, seeing if it's worth your time and energy. And if not, we can figure out a plan where you can have some tools in your practical life to be able to do a little bit of work on your own. And then you let me know if you need services later.
Yeah, so good. Elizabeth, what has been the feedback from the clients that work with you?
I have a lot of clients who will say that throughout their rest and recovery, that's where some of the biggest difference is made, partly because I do work with a heavy neurodivergent population. Rest and recovery does not look the same inside of those brains. And so having someone who understands how a neurodivergent brain actually rests and relaxes, and then being able to provide that for themselves on a regular basis, it's like a whole new life.
Oh yeah, I can only imagine what that's like, to just,
Mhm.
yeah, so good. Elizabeth, thank you for that. I'd like to shift gears and talk a little bit about you and your practice. Is that okay? Um,
Absolutely.
so what motivated you to be a therapist in the first place?
So I had a bit of an interesting route here. I tried just about every job that you could possibly imagine to make sure that, I didn't have anything left on the table. And then when I started college, I was a biology major, moved into actuarial science. So I do come from a heavy math background. And then ended up in psychology. The human systems felt like they were a bigger draw to me and that I had more ability to really make a difference with people and their lives in ways that were applicable change. Actuarial science doesn't so much provide that.
Yeah, I can imagine when you're sitting behind a
Mhm.
computer and dealing with Excel and all the calculators and
Yeah,
stuff. Yeah, I could see that.
I much
Elizabeth,
prefer the humans.
yeah, I'm with you. What do you enjoy the most about the work you do?
I think it would have to be investigating people. And by that, I mean allowing people and sitting with them while they are getting to know themselves in a layer that they hadn't before. Most of us, we live in capitalism and it is what it is. So we're on our 9 to 5s and we're racing and running. We got to get the next thing done. And then we've got kids that we got to pick up and the next thing that we're on to. And really getting that chance to, for an hour, 90 minutes, to sit and be with yourself, be with your own thoughts, figure it out, and have a guide to help that investigation. Getting to know yourself is a big part of it. And watching that happen, it's like a light bulb that turns on and you can see those gears. And that is a great joy for me.
Yeah, I resonate with that a lot. Those eureka moments, where they come in
Mm,
and they're like, "Oh, and they share their victories." And it's such a privilege to be able to witness that growth in person and in the office or virtually. So, yeah, I resonate with that a lot, Elizabeth. I'd like to ask about your practice. What's on the horizon for your practice? Are you mentioned coaching. Can you kind of tell us a little bit more about that and what's on the horizon?
So with that framework that I have developed, I do that generally in my practice, and I'm moving into training clinicians to practice that as well if they would like. It works as a meta framework, so we're still using a lot of the same interventions. Billable to insurance works the same way as far as documentation goes. So I'm doing a little bit of training with that, and then more of the consulting and the coaching. Got a bit of a heavy caseload on the therapy right now. So I'm pivoting a little bit more to the practical side of things, which does give it a larger delivery as well. Essentially, if we can get some of the workplace systems to accommodate by design, we're going to have a whole lot healthier workforce, and my job automatically gets a lot easier.
Oh yeah, I bet. Excuse me, Elizabeth. So are you thinking about bringing on some staff members? What does that look like for you?
Now I'm having fun with the small business solo thing. At some point, if I grow too big, I'll have to bite the bullet and do that. But for right now, I have a whole lot of energy, a whole lot of time, and a whole lot of fun.
That's wonderful. Elizabeth, what do you do outside of the office?
I play with my cats and I knit, and I also enjoy baking a lot of different things that keep my little hands busy, along with making interactive tools.
Oh, that is so cool. Elizabeth, thank you so much for coming on to the show. Really appreciate your time. And maybe we could do it again in the future. How does that sound?
Absolutely. I would enjoy that very much. Thank you very much for having me.
You're welcome, Elizabeth. All right, everybody. Till the next one. Signing out. Bye.